to continue part 2 of diagnosis of hypothalamic disease. Also, in addition to assessment of hormones of the target organs affected by the hypothalamic pituitary unit, we have to look for to assess the function of the adrenals. They also have to do adrenal function tests, thyroid, so thyroid function tests important, including free T3, free T4, TSH. In addition to the TRH, of course, we have to look for also gonadal function tests, including, as I mentioned, the estrogen or estradiol, and in the reproductive cycle or the reproductive age, or estrone in postmenopausal ladies. We have to look for also the estrogen-testosterone ratio and to see whether they are disturbed or not. We have to also, in addition to these hormonal assays, we have to do some what we call stimulation, hormonal stimulation, and hormonal suppression tests, which are static and dynamic tests looking for and then to do timed blood hormone estimations after the injection of the hormones, depending on the suspicious or the which hormones exactly are suspicious of being or suspected of being deficient. Whether it is the CRH or the TRH or the GnRH or the growth hormone releasing hormone or the prolactin, we have to assess all of these hormones, static and dynamic hormonal tests. Which of course we know them in the endocrinology field. This in order to reach to the functional, so because we have to assess the hypothalamus functionally and also radiologically. So to do functional tests to assess the functional status, I mean the functional hormonal status of the hypothalamus and the pituitary, plus or minus the pituitary, and at the same time look for to do a radiological diagnosis of hypothalamic disease to reach to the structural cause or the pathological cause. So we have to do a physiologic functional diagnosis of hypothalamic disease and also pathologic diagnosis of hypothalamic disease through carrying on CT scan of the brain or MRI of the brain. This is very important. And other neuroimaging modalities also, in order to see the possible pathology involving the brain, including brain tumors, including also vascular disease, including inflammatory disease. So according to the suspected underlying pathology, whether it is vascular or neoplastic or inflammatory, we can carry on which we can choose and select which neuroimaging technique will be valuable. But generally, among the basic radiologic tests which we do in order to reach to pathological diagnosis of hypothalamic disease is to do CT scan or MRI of the brain. So these are all tests, the hormonal tests, the injection of hormones, and collection of timed blood samples to look for the hormones through hormonal stimulation and hormonal inhibition, and also blood chemistry tests, including the CBC, including the ESR, including the kidney function, thyroid, the liver functions, the urea and electrolytes, sodium, potassium, etc. All of these are important. Assessment of the adrenal functions, assessment of the thyroid functions, assessment of the gonadal functions, and also CT scan, MRI of the brain, looking for the any lesions at or near the hypothalamus. Also carrying on visual field testing, that's examination of the eyes to assess the visual fields and visual acuity, because of the possibility of visual field defects, especially in cases of hypothalamic hamartomas and tumors arising near the Rathke's pouch and the pituitary and the hypothalamus. These are all important to carry on. The visual field examination and visual acuity is very important as a part of any investigations for pituitary or hypothalamic disease. So these are all tests which we are doing for diagnosis of hypothalamic disorders or hypothalamic syndrome. And before all of this laboratory and radiologic and hormonal assays and these things, do a thorough physical examination of the patient and take a good history, looking for any symptoms suggestive of hypothalamic disease. As I mentioned, whether the underlying cause, the underlying pathology, symptoms of the underlying pathology, like headache, like visual field defects due to tumor of the hypothalamus, intracranial tumor involving the hypothalamus, or looking for symptoms of endocrine failure due to deficient hormones of the hypothalamus as a result of damage of the hypothalamus plus or minus the pituitary gland. Thank you so much, and in my next episode I will discuss the syndromes related to the thalamus or the thalamic disease and the clinico-pathological criteria of thalamic disorders. Thank you so much.